Hi, welcome to the Healthy Life channel. You must be familiar with acid reflux disease. Acid reflux disease occurs when the lower esophageal spitcer becomes weaker than normal. Under normal conditions, the muscle is supposed to contract and close the passage to the esophagus after food or drink descends into the stomach. In acid reflux patients, the muscle is weak, so the esophagus will remain open and stomach acid will rise into the esophagus. When this happens, you will also usually have a sour taste in your mouth, chest and throat pain, dry cough, hoarseness, and difficulty swallowing. Rising stomach acid can also be a symptom of GERD. If left unchecked, it will certainly interfere with daily activities. The factors that cause stomach acid to rise certainly come from the drinks we consume. The easiest way to treat this disorder is to avoid drinks that trigger acid reflux. There are several drinks that trigger acid reflux that should be avoided or the amount reduced. Here are some drinks that trigger stomach acid that you should avoid. 1. Alcohol. Alcohol can stimulate cells in the stomach to produce more acid. This can lead to increased stomach acidity, which in turn can trigger symptoms such as heartburn and acid reflux. Alcohol can damage the gastric mucosa, the protective layer that lines the stomach wall. Damage to this layer makes the stomach more susceptible to the acid produced, leading to inflammation and irritation. Alcohol can weaken the LES, lower esophageal sphincter. The LES is the ring muscle at the bottom of the esophagus that acts as a barrier to prevent stomach acid from rising into the esophagus. Weakening the LES causes stomach acid to easily rise into the esophagus and cause symptoms of acid reflux or GERD. 2. Coffee. Coffee is acidic, which can increase the acidity in the stomach. This added acid can damage the stomach lining and cause irritation. The caffeine in coffee can stimulate the production of stomach acid. This can cause increased acidity in the stomach and trigger symptoms of acid reflux or GERD. Coffee can also stimulate the production of the hormone gastrin, which in turn increases stomach acid production. For people with acid reflux, reducing coffee consumption can help reduce symptoms. 3. Carbonated drinks. Carbonated drinks are the next beverage that can cause stomach acid to rise. These drinks contain carbon dioxide, which forms gas bubbles in the stomach, increasing pressure and pushing stomach acid up the esophagus. Drinking too many carbonated drinks is acidic, increasing stomach acidity and triggering acid reflux. Some carbonated drinks, such as cola, contain caffeine, which can stimulate stomach acid production and can also cause LES relaxation. Sugar and artificial sweeteners in carbonated drinks can cause bloating and worsen acid reflux symptoms. Reducing or avoiding carbonated drinks may help reduce acid reflux symptoms. Acid reflux symptoms can vary from individual to individual, but usually include a burning sensation in the chest, acid regurgitation, and sometimes difficulty swallowing. Reducing or avoiding consumption of such beverages can help reduce acid reflux symptoms in many people. See a doctor immediately for further treatment. This video is for educational purposes only. If this video is useful, don't forget to like and subscribe so you don't miss other videos.